Yeah, that's exactly right. Everybody's getting ready, right? And what we know is that healthcare workers are first in line, but more specifically, the 2 to 3 weeks of the first 2 to 3 weeks, I should say, of this mass vaccination effort will specifically focus on intensive care unit and emergency room staff who directly interact with COVID patients. It's our best shot.
If we're looking for a way to not just push the curve down, but to crush the curve.
And hospitals stand ready.
We do expect that the emergency authorization of the Pfizer vaccine is imminent after Thursday's hearing.
Authorization could come hours later.
The CDC has told us that they will ship the vaccine within 24 hours of approval,
with doses reaching COVID-facing healthcare workers shortly after that.
We'll be prepared and ready to receive the vaccine as early as Friday.
Connecticut's shot in the arm to crush the curve.
The right thing for ourselves, the right thing for our families, for our neighbors, our coworkers, and our classmates. And quite frankly, the more of us that do this, the more effective it's going to be.
The FDA independently reviewed the vaccine. Let's break it down. Safety and effectiveness, starting with effectiveness.
The efficacy or effectiveness of the vaccine is striking, right? So it's striking across basically every group you could imagine. So independent of age, gender, or race.
About 50% effective 14 days after the first dose, 95% 14 days after the second dose, and 100% effective in preventing serious COVID disease. To safety now, full transparency, side effects are possible and not unexpected.
There's a reasonable chance, sort of in the 5 to 10% range, for the following symptoms. Pain at the site of injection, okay? Muscle aches, fatigue, and a lower incidence, less than 5%, of fever.
Side effects are more common following the second dose. Doctors say feeling fatigue is a signal that your body is responding.
Has everything to do with the fact that that's your immune system waking up